Introduction to this learning session on common infection prevention and control measures. In this session, we will discuss significance of infection prevention and control and describe the different methods of infection prevention. We will also discuss core elements of infection prevention and control and methods used for surveillance. Learning objectives. By the end of the lesson, you will be able to define infection prevention and control, describe the significance of infection prevention and control, describe the different methods of infection prevention, list out the core elements of IPC, list out the methods that are used for surveillance. As per the World Health Organization or the WHO, IPC or infection prevention and control is a practical, evidence-based approach that prevents healthcare workers and patients from being harmed by infections that can be avoided. Effective infection prevention and control requires unceasing action at all healthcare system levels, including policymakers, healthcare professionals and workers, facility managers, and those who have access to healthcare services. In the field of patient safety and the quality of care, IPC is unique and is universally relevant to every healthcare worker and patient at every healthcare interaction. Defective IPC can cause harm and even kill. Without the incorporation of effective IPC measures, it is impossible to deliver quality healthcare. IPC affects all aspects of healthcare, including hand hygiene, injection safety, antimicrobial resistance, surgical site infections, and how hospitals and healthcare centers operate during and outside emergencies. For these reasons, incorporating programs that support effective IPC is particularly important in low and middle income countries where medical hygiene standards and healthcare delivery may be negatively affected by the development of secondary infections. Across the United States, a major threat to patients at various healthcare facilities are HAIs or healthcare-acquired infections. According to the CDC or the Centers for Disease Control, each year throughout the United States, HAIs affect a total of about 5% to 10% of hospitalized patients, resulting in 99,000 deaths and an estimated healthcare cost of $20 billion. A few studies have revealed the prevalence of HAIs in developing countries is twice higher when compared to European countries. Also, the incidence of HAIs acquired in ICUs of developing countries is triple when compared to the USA. Very few studies on the incidence of HAIs in India are available. As per these studies, the incidence rate of HAIs across various hospitals and ICUs in India is reported to range widely from 0.38% to 34.1%. Effective incorporation and implementation of proper IPC guidelines will help reduce the occurrence of HAIs. Adherence to a proper IPC program will help reduce the risk of acquiring secondary infections for the patients and the staff. Implementation of IPC practices will help reduce the risk of the potential spread of disease and will therefore help maintain a safe environment for everyone. The IPC practices are designed to reduce the risk of acquiring HAIs and ensure a safe and healthy hospital environment for the healthcare providers, patients, and visitors. The topics that will be covered in this module include methods of infection prevention, core elements of infection prevention and control or IPC, and methods of surveillance. The following are some of the standard precautions for infection prevention and control. Hand hygiene, personal protective equipment PPE, gloves, facial protection, eyes, nose and mouth, and gown. Respiratory hygiene and cough etiquette. Prevention of needle stick injuries. environmental cleaning, linens, disposal of waste, patient care equipment. Hand hygiene. According to the statistics published by the WHO or the World Health Organization, 1 in every 3 facilities lacks hand hygiene facilities at points of care. As a result of this, thousands of people around the world die every day while receiving health care.